Next, I would like to introduce Shireen Hashemzadeh, who is the Technical Assistance Officer for the OPEC Fund for International Development, to welcome you and make some opening remarks. Shireen.
Good afternoon, everyone. I am proud to talk to you about OFID's long-term commitment to combating HIV/AIDS and supporting universal health coverage. We have witnessed how over the years, AIDS conferences have become a major gathering for those working in the field of HIV, including scientists, policymakers, and development practitioners, among others. It's a unique platform for sharing knowledge, practical experiences, and building partnerships in order to tackle the HIV and AIDS epidemic. For these reasons, OFID is delighted to be part of it and to be here today at AIDS 2018. OFID has been sponsoring the participation of representatives from low development countries at international AIDS conferences since 2004. As part of our mandate to help alleviate poverty, over the past 42 years, OFID has committed over $22 billion in financing the development projects in over 130 countries across the globe, of which $665 million has been in the form of grants. We became involved in combating HIV/AIDS because of its impact on development. At the beginning of the millennium, we indeed witnessed how devastating the AIDS pandemic was in undoing decades of economic growth and social progress, and that it was undermining our partner countries' effort to reduce poverty and improve living standards. Concerning health sectors, OFID's financial assistance has not been only limited to combating HIV/AIDS, but has also supported initiatives aimed at preventing and treating other high-burden diseases such as tuberculosis, malaria, non-tropical diseases, and non-communicable diseases, which affect disproportionately poor developing countries. Overall, and since its establishment in 1976, OFID has committed almost $1 billion in support of health programs and projects at the global, regional, and national levels. Africa accounted almost half of its assistance. On the way forward, OFID will continue supporting health interventions aimed at enhancing access to quality care and strengthening the capacities of national health systems with priority to low-income countries. Despite the significant progress made in fighting the AIDS pandemic and the recent encouraging results, this is no time for complacency, as AIDS remains the leading cause of death among teenagers in sub-Saharan Africa. Further efforts are also needed to reach key populations in regions such as Eastern Europe and Central Asia and Middle East and North Africa. We share the view that the most effective way to support these efforts is through interventions aimed at strengthening national health systems, achieving universal health coverage, and providing access to safe and affordable medicines and vaccines for all, which is in line with the SDGs framework. We are confident that the world community, represented by the organizations which are presented here today, will make giant steps toward victory over AIDS, and OFID will be at their side throughout this campaign. Thank you.